Welcome to the Australian Centre for Child Protection's webinar on Empowering Young People's Lives Beyond Out-of-Home Care Symposium. My name's Leah Bromfield and I'm the Director of the Australian Centre for Child Protection. I'd like to commence by acknowledging the Kaurna and Whadjuk Noongar peoples, the traditional owners of the lands from which we are presenting today. I pay our respects to elders past and present, and I extend those respects to the traditional owners on the lands on which we're all joining from today. In the context of a webinar on transitioning from out-of-home care, I particularly want to acknowledge the resilience of Aboriginal peoples, the strength and protectiveness of culture, and the continuing and direct impacts of colonisation, structural racism, and forced removal that are impacting Aboriginal peoples today. As a centre, we commit to decolonisation, to supporting Aboriginal self-determination, and to doing all that we can in our roles to help build a better future with and for Aboriginal children, families, and communities across our nation. Welcome to all of you joining us for today's symposium. With more than 300 registrations, we're really encouraged by the level of interest in the issues and the opportunities to better support young people's transition from care. You'll hear from members of our research team with insights on a range of research projects in this area, including understanding the development and life outcomes of care-experienced young people, how we can improve parenting support to prevent intergenerational out-of-home care experiences, and how we can better support care leavers. We'll also welcome Dr. Andy Kazim, who's been pivotal in the WA Homestretch initiative, and he'll be joining Melissa O'Donnell in conversation, bringing a policy and real-life lens to the work. Some housekeeping before we begin. We really welcome your engagement throughout the symposium. You're invited to use the Q&A function to pose questions and share comments throughout the webinar, and we'll be monitoring this and putting as many of your questions as we can to the presenters in a Q&A panel following the formal presentations. We will be recording today's symposium, and you'll be sent a link to the recording after the event. It's also going to be posted on our website and on our socials. You'll see it everywhere. Following the event, our final slide will have a QR code with a feedback form, where we'll be seeking your feedback on today's session, as well as your suggestions for future seminar topics and areas that you'd like to hear more about. Our follow-up email will also have a link to the feedback form and the presentation. We'd be really, really grateful if you could provide us that feedback. Now, without further ado, it's now my great pleasure to introduce Professor Melissa O'Donnell. Melissa is the Deputy Director of Research at the Australian Centre for Child Protection. She's a world-leading researcher in the field of child protection and out-of-home care, and she's passionate about creating evidence to drive positive change. Her research has been central to the homestretch reforms, and Melissa will be presenting today on the topic, Improving Support for Care Leavers, from Research and Advocacy to Action. Welcome, Melissa.
Thanks so much, Leah. And I also wanted to pay my respects to the Aboriginal custodians of the lands that I'm on, which is Noongar Boodja, and also the lands that you're all meeting on around the nation today, and pay my respects to elders past, present and emerging. I guess my research in this space started about 20 years ago. I was involved with my PhD with Professor Fiona Stanley around really trying to understand how we can support better evidence around child protection processes and practices. So that's really where I was using de-identified population level data to look at the characteristics and pathways for children and families who enter the care system, as well as their short and long-term outcomes, and where we could try to improve those outcomes. Just to give you some context around the out-of-home care system in Australia, for those that aren't aware, in Australia we currently have around 45,000 children in out-of-home care, and we've seen a rise over time in the number of young people who are aged 15 to 17 years of age leaving care or being discharged from care, as the reports state. And over the 2023 to 24 period, there are about 4,295 young people leaving care, and 39% of those were Aboriginal and Torres Strait Islander children and young people, which really reflects the overrepresentation in the child protection system. I guess in terms of the history of where we're at in terms of care leavers, in 2010, under the previous National Framework for Child Protection, there was a document produced about transitioning from out-of-home care to independence, a nationally consistent approach to planning. And it really put forward a vision was that all young people transitioning from care should receive support from government, non-government organisations, family and carers in the community to reach their full potential. And it outlined that when a young person turns 15 years of age, they should really commence their leaving care planning with their caseworkers to develop up a transition from care plan. At that time, we were also, I guess, doing research on care leavers. In 2017, we were approached actually by the West Australian Department of Communities to talk about the evidence that might be required. At that time, there was fairly robust international evidence that care leavers have some of the poorest outcomes of all young people in the areas of health, mental health, education, employment and housing. So from that research that we did with the department, we reported our own findings in 2018 on the outcomes of young people who'd experienced out-of-home care. So from those findings, when we look at a group that was similar in terms of socioeconomic background, but not care experienced, young care leavers had 2 times higher hospital admission rates. They were 3 times more likely to have mental health service contacts. They were also 3 times higher in terms of death rates, with a predominant cause of death being suicide. And they were 2.5 times less likely to receive a high school completion certificate, and also 6 times less likely to be university bound. They were also 3.5 times more likely to have community-based sentences within juvenile and adult correction services. So we obviously knew that there was a real challenge in terms of how we can support young care leavers in getting better outcomes. Prior to 2020, a lot of young people were being referred to leaving care services. However, the support provided was variable within and across states in Australia. And it was also very difficult to determine who was actually receiving services and what difference that was making for them. In 2016, the National Homestretch campaign commenced, which was led by Paul McDonald. It was really trying to bring together organisations, individuals and advocacy groups committed to trying to support young care leavers. The vision at that point was that care leavers should have a place they call home and support up to and beyond 21. We're really acknowledging that they continue to experience poor life outcomes on all measures compared to their peers. And it was really about trying to level the playing field for young care leavers. In terms of WA, where I was working at the time and still do a lot of work, we did start a homestretch campaign in 2017, which was launched particularly by the Anglicare, who really tried to bring the sector together. We also, at that time, there was an approach to the Child Protection Minister, Minister McGurk, and she actually announced trial funding. So Anglicare and the Department of Communities were leading the co-design of a homestretch extended care prototype. So they brought together sector representatives such as myself and other people in the sector, as well as young people with lived experience. And really, they called it a design sprint. So bringing together that collective group of people who could really support care leavers and hear the lived experience voice. Andy Kazim was involved at that time from Anglicare, and myself as a researcher. And there were a number of young people with care experience who were involved. What we really came up with was a WA model for homestretch. So we talked about the need for a safety net. So a right to visible, secure safety net that ensures access to housing, health, education and life skills. In that, Andy was instrumental in helping do the tools and resources needed. So a staying on agreement that we needed, a housing subsidy, the need for Invest in Me funding, and transition support for flexible one-to-one support focusing on coaching towards interdependence. really trying to ensure a smooth transition, and the transition coach would work with the young person to look at their goals and what they wanted to achieve to support that transition. And then there were support circles. What we realised from young people who were really involved in the co-design was that often young people didn't have a really strong support network around them. And so the support circles were a way of supporting a young person to establish an enduring network of personal, family, and community connections. And we call that the support circles. And actually, it was Yorganup and the work with Yorganup who really helped design an Aboriginal culturally secure process for homestretch, as well as the Nitchinop Yorga Nula Maya, which is our young people are coming home. So I was really looking at how we can embed young people into their community and cultures, particularly after leaving care where many of them were separated. In terms of the Homestretch WA trial, Minister McGurk announced funding for Anglicare to lead the trial in Fremantle, in the Fremantle district, and Annie Kazim led the practice team to make the model into reality. They developed a homestretch community of practice, and the young people involved in that were really integral to its success. And Annie and the team, including the young people involved, won the 2023 WA Youth Awards for the community of practice. The assistant director at the time, Michelle Beer, also said young people have been and will continue to be at the heart of design, development and delivery, alongside with the collective efforts of service providers from across the state. Really hoping that we could embed the implementation and ensure that care leavers got the support they needed. Victoria at that time was also launching their Homestretch program, which built on their existing Better Futures program. However, in 2020, COVID lockdowns commenced, and that was really difficult for a lot of people across the country, but particularly for care leavers. There was a number of us, including myself and others, who were on the COVID Youth Task Force, and our question was, where are young people leaving care going to go? Foster carers and kinship carers were saying we can't just put these young people on the streets when they turn 18. Resi Care was struggling because they didn't know where to place young people when there were lockdowns in place. What happened was that there was a lot of advocacy around that time to really implement and roll out Homestretch to every young care leaver in the state. And in 2021, Minister McGurk did announce that. So from 2021, the implementation and rollout for the WA Homestretch model started. So where are we nationally in regards to the support for care leavers? As I've said to you before, WA has universal access to the Homestretch program, which allows the allowance and caseworker support. In Northern Territory, they are implementing some extended care, and in South Australia as well, they've got foster and kinship extended care, but unfortunately no guaranteed support for residential care at this stage. Queensland are developing and implementing their universal care model. New South Wales are the same. As I said before, Victoria already had the universal care model in place for allowance and caseworker support. ACT in 2024 have just legislated a right to access care, and in Tasmania, extended support is available for foster and kinship, but still no guaranteed support for resi care. So I guess what you can see from this map is that work is not finished in regard to Homestretch. There is variability in offerings across each state in terms of the funding support and the level of casework support being provided. And there is now calls for a push for a national minimum level of funding and support, with groups such as the newly established Homestretch South Australia group through CAFSA, which I'm involved in, pushing universal support for young people leaving care, particularly residential care. There's also specific subgroups of young care leavers where tailored support will be required. For example, young care leavers with disability, and we know from our research that's about a 30% group, with many having to navigate NDIS. The other group is young parent care leavers, which we're going to talk to you about today as well. There is also ongoing challenges for care leavers with the housing crisis, so our work is not finished. This paper has just recently been published by Mendes and a group of us, including myself, about the introduction of extended out-of-home care until 21 years, mapping the policy, legislation and programs in each jurisdiction, if you'd like more information. In 2019, we also commenced a research project, which was led by Professor Donna Chung and Dr. Lauren Parsons on young people leaving care, which the young people called the Navigating Through Life project. And it was really trying to look at the pathways and outcomes of young people in and transitioning from care. And really, we were trying to map the pathways as well as the lived experience for those young people and looking at the key factors for successful transitions. Through the Navigating Through Life study, we had access to, I guess, two groups of data and data collection. There was the de-identified linked longitudinal data, which included data from child protection, health, mental health, housing, education and justice. And we had an out-of-home care group, so those really aged between 15 to 21 years. And then we were also able to compare the outcomes to young people who had child protection contact, but no out-of-home care, as well as a no contact group who had no contact with child protection. The longitudinal study involved recruiting young people who were leaving care and transitioning from care between the ages of 15 to 25, and we had approximately 200 young people involved in that. There was interviews that were conducted every 6 months, basically over 2 years. And also we had standardised measures that the young people participated in as well. At that stage, not many of them had access to home stretch during that follow-up period because it was only just being implemented. So today you're going to hear about different areas of the research that was done in this area. Dr. Fadzai Chikwava actually completed her PhD using the Navigating Through Life data and actually participated in some of the interviews with the young people. And she's going to talk to you about mental health resilience and independent living skills, as well as housing stability. And Dr. Miriam Maclean is going to talk about pregnancy and child protection involvement in young people with care experience, as well as some of the educational employment data. And then we've got Renée, Usher, who'll be talking about the experiences of young mothers transitioning from care through the interview data with young care leavers who are mothers. So I'll pass you on to Fadzai now to talk about resilience, mental health and homelessness among young people transitioning from care. Thanks so much, Fadzai.
Thank you, Mel. Thank you for that introduction. Welcome to all the viewers today. Thank you for joining in. So today I'm going to talk about some of the findings from my PhD study, which was resilience, mental health and homelessness of young people transitioning from out-of-home care. And first of all, I'd like to acknowledge the traditional custodians of the land on which we meet today, the Wajak Noongar people, and pay my respects to the elders past, present, and emerging. I'd also like to acknowledge my supervisors who are also my co-authors on the papers that I'm going to present today. So just to give you a bit of context around the study, so you find that the growing numbers of children in out-of-home care is quite concerning. It's on the increase, and we continue to see young people of Aboriginal background being overrepresented in the care system. You find that when young people leave care, they face poor outcomes such as mental health, housing instability, and homelessness. So the study that we did, it's unique in the sense that no previous studies have actually assessed the impact of being in out-of-home care at a population level while using population level data integrated with longitudinal survey data, as Mel has already presented. And examining the data at a population level really provides valuable findings that can be generalized to Western Australia and to other states. So as already mentioned in terms of the study, the Navigating Through Life, it was comprised of 3 studies. I utilized 2 studies, study 1 and study 2, which was the linked administrative data from Western Australia and Victoria. And the mixed method study, I used the baseline findings, which was comprised of young people who were about 122 and following them up over those different waves. Okay, so to start with, I'm going to talk about the data from Victoria, which was a paper on trajectories of homelessness and association with mental health and substance use disorders. So these were young people who were aged between the ages of 15 to 18 years. And the data was utilized from 2013 to 2014 we looked at pre-care and in-care factors which were influencing those trajectories in the first 4 to 5 years after leaving care. Then in terms of the research questions, as I've mentioned before, we used the Victorian data. We're interested in finding out if there were any subgroups of young people who had different homelessness pathways after they left care going into adulthood. And previous research has actually shown that substance use and mental health are independently associated with homelessness. But in our case, we wanted to see the dual diagnosis of mental health and substance misuse to see how that is associated with those trajectories. Okay, so going on to the findings, as you can see on the left-hand side, we've got the Victoria and Western Australian data. It shows that about 3 in 5 people experience housing instability in both states, which is quite concerning. And if you look at those figures, it actually shows that we're not only focusing on those young people who are visibly homeless, but a wide spectrum of housing instability using what is called the European topology of homelessness. So that includes all different forms, for instance, couch surfing, staying in shelters, or temporary housing accommodation. And on the right-hand side, as you can see, you find that young people with a dual diagnosis of mental health and substance misuse were almost 5 times more likely to experience homelessness. So this actually presents a risk when young people have got both mental health and substance misuse disorders. So moving on to the trajectories, you find that these results show 3 different groups that we found out from the study. The class 1, the moving on group, which was sort of the majority of the young people. Then class 2, call them the survivors, and class 3, the complex group. So if you look at class 1, these are young people who are mostly from foster care, and they had low levels of homelessness risk, as you can see from the graph. However, if you see the graph, there's actually a slight increase in terms of the trajectory over time, which is quite concerning. And if these young people don't get the necessary supports, who knows, 10, 15 years from now, the homelessness risk may be increasing even more. Then if you look at class 2, they started off with very high homelessness risk. So these young people comprised young people, it was a mixture of young people from residential, foster care, and kinship care. However, what is striking about these young people is that they had a history of substance misuse disorders. Maybe this could explain why they had high homelessness risk in the first year of leaving care. However, over time, you see the trajectory is going down, which could be a result of, getting the supports they need or being reunited with their parents or carers. So you find the importance of getting supports could actually improve housing instability of these young people. And then if you look at class 3, the complex group, which is the most concerning, you find there's a rapid increase in terms of homelessness trajectories. These young people are actually mostly from residential care settings. And in terms of the key characteristic of this group, these are the people who had chronic mental health and substance misuse during the time they were in care and after they had left care. And this could have contributed to their worse homelessness outcomes. So I find that with this group, this is where we need to think outside the box, and think about new approaches to tackle homelessness amongst this complex group. Okay, so now I'm going to move on to the next paper, which I worked on, which is on resilience and mental health and the role of social inclusion, self-determination, and independent living skills. So this study was from Western Australian data. So in terms of the research questions, we actually wanted to know the relationship between adverse childhood experiences and poor mental health, and whether those resilience processes actually had an effect on mental health outcomes. So we used the validated measures from the Navigating Through Life study. And the second objective was to really look at whether there were any differences in resilience and mental health outcomes amongst those people who were still in care and those who had left care. Because as you saw with the homelessness trajectories, you find that those young people who've left care, they actually face a poor homelessness for specific groups. Okay, so that graph really shows the findings of the study, and it really shows the beauty of integrating linked administrative data and longitudinal data, because we utilized measures from both studies. So social inclusion, self-determination, independent living skills, resilience, mental health. These measures are validated and they came from the survey data we used. And from the administrative data, we utilize the child protection data. That's where you see your adverse childhood experiences, the child protection notifications, placement stability, maltreatment, and whether they were still in care or out of care. So the green arrows actually shows those factors which were positively associated with resilience and mental health. So this really emphasized the importance of social inclusion and for young people to be stable in care and to have those independent living skills for them to navigate transitions from out-of-home care. We also need to keep looking at adverse childhood experience and how that can be addressed, and also the child protection notifications. So the higher the child protection notifications that are reported result in poor mental health outcomes. Also, in terms of those young people who left care, you find that they were more likely to have poor resilience and poor mental health once they left care. So this is the model which actually involves social inclusion, which was quite similar to the model where I utilized self-determination, but you find that the effects for self-determination was much larger compared to the one with social inclusion. Then coming to the end now, you find that, as you have seen, young people are actually not a homogeneous group. We saw the different subgroups of young people, and they would have had different experiences whilst they were still in care and also after they've left care. So you find some are doing well, some may be struggling as well, and therefore there needs to be those different tailored supports to support the young people. And for the young people who have left care, it is really best to try and offer extended supports, such as the home stretch trial, especially in the first 2 years of living care, when they are the most vulnerable to homelessness, and to really prepare them for those independent living skills. And then in terms of self-determination, I think it's really good that, young people are actually involved in co-designing those transition plans. I remember when we were doing some interviews, the young people were actually struggling, were actually mentioning that they were not involved in co-designing transition plans. So it's important to promote their participation in service design, evaluation, and also in policy formulation. Then looking at placement instability. So it's not just really looking at whether young people move from one placement to another, but just really adhering to those placement principles in terms of making sure that young people are actually placed with their kinship carers or even closer to the communities in which they live. Lastly, I'll say that prevention is better than cure. Let's invest early in early targeted supports, tackle the vulnerable amongst those families, address those intersecting vulnerabilities, family domestic violence, substance misuse, and many others. So thank you very much. I'm going to hand over to my colleague, Dr. Miriam Maclean, to present her findings. Thank you.
Thanks, Fadzai. I'll just open up my slides. Bear with me for a moment. I'll be presenting today on the linked longitudinal data and some of our findings on the areas of education and early motherhood. Here we go. So I'll focus mainly on the findings, but I'll also be happy to share any information about the methodology if anyone wants more details after the presentation. So in WA, we're lucky to have the opportunity to look at the linked longitudinal administrative data following the lives of children born as early as 1990 through to recent births. By drawing on de-identified data across government agencies responsible for health, mental health, education, child protection, public housing, justice, and other areas, we can follow many aspects of the influences and outcomes of their lives as they grow and develop over time. And this gives us a unique opportunity to inform policy and practice with strong evidence from whole population cohorts of WA children. The linked data has many useful aspects. As I mentioned, it's longitudinal. We can study children from birth right through into adulthood and also look at some intergenerational effects as well. We have information on children's context, things such as whether the neighbourhood that they were born into was a higher or lower socioeconomic area, and whether their family were facing challenges, perhaps with hospitalizations for mental health, substance use, or assault victimizations, as well as whether they were living in a remote or metropolitan area. Because the data is multifactorial, we can take into account many influences on the young people's lives. And finally, we can combine it with surveys and interviews, allowing studies that quantify the prevalence and risk factors at a population level, as well as looking at lived experience through qualitative analysis, like Renée will be covering next. So the first topic that I'll touch on is education and out-of-home care. We know, as Melissa mentioned, that young people who have been in out-of-home care are less likely to get their high school certificate, the WA Certificate of Education, and less likely to be university bound. My early PhD research was looking at education for children who've been in out-of-home care. So we know this isn't an issue that suddenly crops up at 17 or 18. Many of these children have early low achievement that remains low throughout their schooling years, unfortunately. And there's often declines even amongst children who started off fairly strong academically. And this isn't surprising when we think about the complexity of their lives and the changes that they may be experiencing. We know that maltreatment is a significant contributor to academic difficulties for these children, along with things such as attendance issues, whether they're getting the right support, their psychological well-being or lack thereof, and also disruptions at home and at school. Although child involvement in out-of-home care, placement in out-of-home care, has some protective effects on education for very young children, particularly around better attendance, cognition, and language skills, they're more vulnerable socially and emotionally. And by the time they get to adolescence, they often have more academic difficulties. Once they reach the end of school, they're also facing a lot of challenges in that they're to some extent often fast-tracked into independence, while many young people in Australia remain living at home throughout their studies, or at least have the fallback of being able to move back home if they do hit any problems while they're studying. For a lot of care experienced young people, this may not be a fallback they have available, and they're still dealing with all the transition to adulthood tasks of finding a job and housing, and many of them are also dealing with mental health challenges, unresolved trauma. A higher proportion are facing pregnancies and parenting at this age. So education can be an additional demand that seems like too much on top of all that. So we really need to think creatively about how to make sure that education, further education, is something that's accessible and affordable. So to improve education outcomes for this group, we need to address both ends of the age spectrum. For those who are young, we need to ensure they have psychological and academic support to have good school readiness socially, emotionally, and cognitively, and have the support available throughout school so that when they do face any issues and difficulties, this can be addressed early. For those at the end of their school journey, we need policy that takes into account the big picture of these young people's lives and increases affordability and access. Some ideas have been put forward by those involved in the Home Stretch campaign, including providing free on-campus housing or an education fund that all young people who live in care can access when they're ready, which may not be when they turn 18. Also making care leavers an equity group so that there's a focus on monitoring their inclusion. and more broadly ensuring that the other life issues don't create an impossible obstacle to education. So next I'm going to touch on pregnancy and intergenerational removals. Using the data from the Navigating Through Life study from around 200,000 girls born in WA, we wanted to look at the prevalence of births and subsequent removals of children to out-of-home care. The youngest girls in the study were only 13, so the proportions will be even higher as time goes on and we see the results all the way up to age 25, although some of the participants had reached that age. So by the age of 25, a birth had been recorded for less than 1 in 20 of the girls and young women with no child protection contact. But for those involved in the child protection system, whether they'd been in out-of-home care or not, around 1 in 5 had had a baby by age 25. So next we wanted to look at child removals to out-of-home care. And among these young mothers, we found that those with out-of-home care experience themselves were significantly more likely to have a child removed to out-of-home care, at 21%, compared to those with child protection contact only, who around 6% of these young mothers had a child removed. Removals were also more likely in a context of housing instability, mental health issues, maternal convictions, assault victimizations of the mother, low socioeconomic status, and also amongst the younger mothers within our already fairly young sample. So we found that clearly both becoming a mother at a younger age and having a child removed were more common amongst the out-of-home care group. And this highlights the need to break intergenerational patterns. And one of the ways to do this is providing wraparound supports for those who do have a baby, as well as intervening at any life stage to address these issues of mental health, housing, poverty and disadvantage, FTV, and so on. All of these have a part to play. So I need to thank the organisations and people that make this possible, including Data Linkage Services, our industry partners, co-authors and participants. And I'd like to leave you with 3 takeaway key messages today. The first is to reiterate the importance of providing psychological and academic support to children so that they have that school readiness and that any academic issues that arise, as well as any emotional ones, can be supported early on so that they have the opportunity to do their best at school. Secondly, the importance for holistic and flexible policies that take into account the big picture of these young people's lives, that reduce obstacles and increase the accessibility and affordability of further education. And then finally, I want to emphasise the need for supports to break these intergenerational cycles of removals and increase supports to empower these young mothers to create a different outcome for their own children. And Renée will be talking on this more in the next presentation. So thank you all, and I'll hand you over now to Renée.
Thanks, Miriam, and hi everyone. I'm Renée Usher, and I will be sharing insights from young care leavers, mothers in WA, and also how their experiences can inform better parenting support and help prevent intergenerational out-of-home care. In 2020, we used a subset of data from the Navigating Through Life project, which tracked the experiences of young people transitioning from out-of-home care in WA. Participants for this study aligned with the NTL project, which included young people aged between 15 to 25 years, with 6 months lived experience of out-of-home care, and the additional criteria of being female and a mother. We use a qualitative approach in this study, analysing interview transcripts through a reflective thematic analysis to explore the narratives of young women with out-of-home care experience, focusing on their transition into independent living and parenthood. We identified 11 young women from across metropolitan and regional remote areas who were mothers, 4 women identified as Aboriginal, and 7 were non-Aboriginal, and aged between 18 and 25 years. At the time of this study, 10 women had their children in their care, while 1 had experienced the removal of her children by child protection. Most mothers were single and parenting on their own, typically as a result of domestic and family violence. We analysed 28 interview transcripts in total. It's important to note here that the participants who completed 3 or 4 interviews were all non-Aboriginal mothers. Although ethnicity was not a central focus of this study, we acknowledge that it's a limitation and recognise the need for further research, particularly in the light of the overrepresentation of young Aboriginal and Torres Strait Islander women and children in the WA care system. Our analysis revealed a clear hierarchy of themes, with one overarching message being that the child protection system often failed to meet the needs of these young women. Most could not recall discussing a leave-in care plan or felt that the support offered did little to prepare them for independent living, especially as young mothers. While some received assistance with basic needs such as housing, food, or healthcare, many still felt under-supported and unprepared for the realities of transitioning to both independent living and parenthood. Despite these challenges, the women were deeply motivated to raise their children in more stable and nurturing environments and free from child protection involvement. However, they also felt the systems surrounding them were not equipped to support their goals. We also identified 2 key themes: breaking the intergenerational cycle of out-of-home care and accessing needed support. Most of the women expressed a deep determination to parent differently from their own upbringing. While they feared being monitored by department workers or having their children removed, that fear also drove them to prioritise their children's well-being. Therefore, motherhood became a powerful source of motivation and resilience in driving their desire to break the cycle of out-of-home care. The children in the foreground sub-theme really reflected the central role that children played in the young women's lives, as all mothers described a strong emotional bond with their children and a desire to give them a better life, even for the mother who had her children removed. For some, becoming a mother prompted positive lifestyle changes and a new identity beyond their experiences as a kid in care. The legacy of child protection involvement sub-theme described the long-lasting impacts of out-of-home care, as most lacked safe family connections and often felt judged when seeking help from the department. There was a strong sense that their histories shaped how they were treated by workers as parents, and even how they saw themselves in that role. When it came to getting needed support, many relied on their informal networks. Relationships with friends, partners, carers, or service providers often filled the gaps left by formal support systems, as mothers frequently struggled to meet basic needs such as managing finances, finding stable housing, or navigating the everyday responsibilities of raising children, while also managing the impact of their own histories. Housing was also a major concern, especially during the COVID-19 pandemic. With fewer options and long housing wait lists, this was further complicated by the fear that housing instability could be seen as a risk to their child's safety and a cause for removal. Mothers also highlighted gaps in reproductive and sexual health education. Some stated they didn't receive basic support during puberty or pregnancy, and one mother reported stealing sanitary products because her carers wouldn't provide them for her, and any parenting support from department workers was often viewed as inconsistent or completely absent. While most mothers desired to pursue further education or employment, many were forced to put those plans on hold due to limited access to childcare and lack of financial support. Most mothers relied primarily on Centrelink payments, which barely covered the cost of living and raising children. Finally, without family support, many of the women created their own support networks. These relationships provided emotional safety, parenting advice, and a sense of connection. Parenting dynamics were also complex, with those parenting alone often describing it as a double-edged sword. It was either isolating or empowering. One mother shared that parenting without the father felt easier and safer. For many, domestic and family violence was a key reason for parenting alone. However, those who were able to co-parent spoke positively about the benefits of having both parents involved in their children's lives. So how do we translate this into policy? Leaving care planning is intended to be a key part of transitioning from out-of-home care, yet the majority of the women in our study didn't recall having such a plan. This may be because they weren't actively involved in the process, or because any planning that did occur may not have been communicated clearly or followed up on. These plans are meant to give young people the chance to identify their goals and the support they need for independent living. Therefore, their active participation is essential, not only to uphold their rights, but to also build trust, stability, and lasting relationships. For young care leaver women who become mothers, effective care planning is particularly crucial to support both their own needs and those of their children. Just go back. While the mothers acknowledge receiving general support from the department, their experiences often lack planning and information tailored to their specific needs as young women, particularly in areas such as early pregnancy, sexual health, and reproductive education. This highlights the need for leaving care plans to adopt a more gendered responsive approach that recognises and addresses these critical gaps. Our findings also revealed a challenging tension within the child protection system. On one hand, the system acts as a corporate parent with a legal obligation to support care leavers, while on the other hand, it holds the power to intervene in their lives and remove their children. These young mothers often face heightened scrutiny of their parenting skills, which can make it more difficult for them to settle into their role as a parent and can also influence how risk is perceived and assessed by caseworkers. Given the disproportionately rates of child removal in this group, it is likely that the current system contributes to these additional challenges. This points to an urgent need for policy and practice reforms that ensures care leavers are well informed, supported, and equipped with the necessary skills and resources to make a successful transition to independent living and parenthood. In addition, removing barriers to accessing childcare is essential for improving opportunities to engage in education and employment, which in turn can help alleviate the broader socioeconomic disadvantages these young mothers often experience. And lastly, the young women spoke about the stigma they faced, both as children in care and as young mothers. However, despite this, many drew strength from their own care experiences, using it as motivation to parent differently and strive to be the kind of parent they may not have had. Research consistently shows that single mothers are often unfairly portrayed as economically disadvantaged, and these negative assumptions can extend to their children, affecting their social and emotional well-being. Reframing the narrative to highlight the strengths and resilience of care leaver mothers is therefore essential for informing more supportive and equitable policies and practices. So as a final takeaway, it is essential to enhance how department workers approach leaving care planning by starting the process early and ensuring it includes pregnancy and parenting supports and options. Adopting a gender-sensitive and strengths-based approach will provide more holistic support for care leaver mothers, recognising their unique needs, resilience, and genuine desire to create a better life for their children. And by getting this right, we move closer to breaking the cycle of child protection involvement and helping more young families stay together and thrive. So we're now moving to a Q&A session with Miriam, Fadzai, and myself. Thank you so much for listening.
Thanks so much, Renée. I'll just wait for you to join us. But I think I think all of the presentations are really good at highlighting different aspects of the care experience. We did have some questions that came through from the Q&A. I'll just first start off with Fadzai. You mentioned we need to ensure cross-sector collaboration when addressing the intersecting needs of young people transitioning from care. How can agencies work together to do this?
Thank you for that question, Mel. I think to answer that, there are different ways in which cross-sector collaboration can be achieved with different people working at different levels. But I think one of the most important things is to have a coordinated shared outcomes framework whereby different service providers really work together to identify what are the common indicators, what are the tools that we're working on, so that there's uniformity, because if there's duplication, then you find you may be collecting the same information. So that there's also alignment in terms of what needs to be measured. as you saw as well when I was presenting with the homelessness data, I utilized data from different government agencies, alcohol and drug use, housing, and also health data sets. I managed to actually look at homelessness across different spectrum. So that's where we managed to actually establish, different rates of homelessness across different data sources. So agencies could do the same, utilizing linked data. But I also think in terms of working in different communities at grassroots level, just trying to understand, what are those shared practices? What are those stories that people can report? But also ensuring that those indicators are actually culturally appropriate by working in those communities. What this helps is that, it really helps in terms of avoiding duplication, underreporting, even over-reporting of data. So just having that shared framework, establishing communities of practice where people can get together and share outcomes. So in closing, I'll say it's really important that young people are involved from the beginning. They're involved in designing those instruments. They're involved in actually doing the research and evaluation. And the framework, when it's done, it's important that it's monitored and evaluated so that you're actually on track, just to ensure that everything is continuously improved and the quality is ensured. Thank you.
Thanks, Fadzai. And there was another question that came through which you might be able to answer. We've talked a lot here about the developed countries in terms of the recommendations and work we need to do in Australia. Do you think, are there any recommendations you think for developing nations?
That's a good question, but I'll say, there's quite similarities when you look at developed and developing nations, because the issues are the same. You want to address poverty, you want to address those economic issues. The scale will be different, of course, but there's commonalities. What is striking as well in terms of developing countries is to ensure that the systems are actually in place for young people to be supported. So that could be different. And that could be a disadvantage in developing nations, where you find that in terms of economies of scale, that could be a challenge in developing countries as well.
Okay, thank you for that. Miriam, there was also a question about what about children and young people leaving care and reaching out to previous service providers? Has this been addressed, and has, as the question asks, that there have been some experiences with some mixed complications around those?
Sure, it makes sense that would happen because young people tend to reach out to those they trust. It's a relational thing. So I guess it's important to ensure that service providers who are working with children in whatever area with these children and young people while they are younger are available to point them in the right direction, even if it's not within their actual work to be covering support for young people who have reached 18 or 21. It's really important that they are available and aware of the services that they can be sending these young people to as young adults, because care leavers may not necessarily have close family members around that they can turn to for those things. So ensuring that the adults who have played a part in their lives at least know how to point them in the right direction, because otherwise there can be such an absence of support. And while these services are being built up through Homestretch and other important services, we need to make sure that they get this is information that all the people who may be able to help the young people can point them to.
Thanks for that, Miriam. And Renée, from your perspective, what else do we need to understand or do differently to support the lived experience of young mothers leaving care?
Yeah, absolutely. So one of the limitations of the study I just presented on was that we used data that wasn't directed specifically for young care leaver mothers. So we were able to identify the themes and make some inferences through the stories that the young mothers spoke about. But what's really missing is the being able to have a more targeted approach in research to really understand the mothers' perspectives, particularly for Aboriginal and Torres Strait Islander mothers. That's one area that was really challenging to try to understand. I do remember one of the Aboriginal mothers spoke about how she was able to get some support from a service, understand culturally the birthing practices of Aboriginal women. So that was something that she had never experienced and was something that she was able to align with her own identity as she made more connections with her culture. So yeah, really we need to have a more targeted approach with these mothers and to also gain a bit more of an understanding and perspective from department workers as well to see what barriers or challenges they may be experiencing with these leaving care plans.
Great, thanks for that. There were some additional questions that have just come through, so I'll just have a look now. What is the child protection difference between street on and off children as per your findings? Did you have anything, Fadzai, that could say whether they were living on the streets or they weren't living on the streets in terms of their homelessness?
I think in terms of the data, we didn't really slice it up in terms of, the roughs, those who are rough sleepers or those who are facing housing instability. But what I can say is that it's a wide spectrum when you look at homelessness or housing instability. It's really, you don't have a tenancy, or you're living in a sheltered accommodation, or you're coming from a psychiatric institution, you're also at risk of homelessness. But in terms of the numbers, I don't have them right away. But what I can say is, it's quite huge. If you look at 3 out of 5 people are facing housing instability, and I think that needs to be addressed rather than just focusing on the ones who are rough sleepers.
Yeah, and I guess there's a lot couch surfing, particularly at the moment as well. I think that was, here we go. Were any young people of care experience involved in any of the studies as co-researchers or the scoping design? I guess I can speak to that as well, and Fadzai, you can as well. We did have a young people's advisory group, and there were co-researchers who did the interviews who were young care experienced people who were helping with interviews. So that definitely was involved. We've also, some of the research questions and the papers that we're producing were priority issues for the young care leavers as well. And we're always open to young care leavers who want to be involved in the research, who want to give us advice and support around the writing of papers. And I guess, Fadzai, you were involved in some of those interviews. That was challenging through COVID, I must admit, but a lot of the young people were happy to do them online. Is that right?
Absolutely. So as Mel has already mentioned, we set up the Young People's Advisory Committee, and we actually had to train the young people. They were very much interested. They didn't have the research skills, but just going through them, basic training, they were so enthusiastic, and just offering them incentives, they were motivated to actually do the interviews with us. Yeah.
Yeah, that's really important. I guess that ends our question time for this panel. We're now moving on to having Andy Kazim talk to myself about some of the questions that are being raised about the practice and home stretch. So we'll just transfer the panel just for a moment. And I just wanted to introduce Andy Kazim. So Andy has been really instrumental in the WA home stretch model. So he was involved in the original co-design when we were meeting with young people. And also he's been involved in he was involved in the community of practice group that was implemented, and also the statewide rollout group because you were helping with the implementation. And that was pretty much over the last 6 years that you were involved in that.
Yeah, look, I just want to acknowledge, I'm standing here after maybe 6 years of walking alongside Aboriginal families, communities, and young people in a really privileged space where I got to listen and learn and understand things from different perspectives. And for me, I'm here not today to speak on behalf of any agency or on behalf of Home Stretch. I guess I'm here in my own lived experience capacity of sitting across that system change and being part of facilitating it. And I appreciate the opportunity to kind of share some of those reflections. I also appreciate I've just been awarded a PhD from Leah. Thanks, Leah. I don't have a PhD, but it was nice.
Yeah, your knowledge around home stretch and support for care leavers, I would say, is probably up there. You're pretty much one of the experts in the country. So I think that's a real acknowledgement that you're.
It was nice.
And the fact that so many others, such as I was just talking to the Home Stretch South Australia group, and they're really keen to have you to one of their meetings to talk about how you implemented the model and developed the model. But just to first question, what are the things that works to bring people together to design a system to support care leavers?
I think what I've learned over the past 6 years, it's about letting go of the assumptions about others. It's about letting go of how we see different parts of the system. It's how we see ourselves and our own expertise. And I think to bring people together, it's about understanding what is the common way of talking about and understanding a problem. And we often in, different disciplines in government, non-government, in sectors have different ways of describing the same thing. And young people and families and Aboriginal communities in each place have the same. So if we don't accept that we need a common language and that none of us alone are right, I think it's impossible to come together to bring a solution. And so what I've learned, and I guess what I've been taught, I've been taught by a small army of people who worked on Homestretch, is that we need lived and living experience and expertise as a constant presence. We need academic and research and learned expertise to be part of the ongoing development solutions we create. And we need those who have practice expertise, who are doing the work on the ground and walking alongside families, to also be recognised equally as valuable. And I think the most important cohort probably is in each place, in each community, because the entire child protection system for me is designed to empower and give young people a connection to a meaningful life in the future. And so if we don't help them and build a community in each place that guides them towards that.
Yeah.
So there's something about place-based, and the leadership and eldership of Aboriginal communities and families that needs to be guiding this. And I think what works to bring people together, it's an acknowledgement that each of those ways of seeing the world are true and valid, and we need to convene systems and mechanisms to allow those different perspectives and expertise to talk to each other. And it's in those common understanding, those kind of aha moments and truths, to find things that work. And that's not like a consultant comes in and does it once and now you find your report. I mean, that is a moment in time. What we need to do is create ongoing dialogue. And I think for me, that is the real challenge, is how do you do that in a system that is about relationships with young people without, breaking down some the ways we've always done things, or some of the ways that organisations or government departments have to operate in terms of the ability to function. So,
and you touched on the lived experience voice, which is really important. And unfortunately, we couldn't have a young person here today. They were unable to make it. And we do have a young person who would like to share some of their views, but unfortunately, we've got a sick child in the house.
Yeah.
So they're happy for us to share their views after this, which we can do online as well. But what do you think has been the value of the lived experience voice in the design and implementation of Homestretch?
I think they provide us the leveling point. Like, I've sat in meetings with government ministers and the Premier when we first presented what Homestretch was to the Premier at the time, Mike McGowan, and Minister. He didn't care what I said. He wasn't interested in what I was talking about. But when one of the young people told him directly that he was better off being supported by the prison system than the care system when he left, that affected his thinking. And I think what lived experience does, it asks us the questions that perhaps we assume we already have answered or we think we know. It challenges us to understand that we're not just working with problems and people's problems, we're working with people. And so for me, young people are equal partners in this, and to have a successful system, it's about empowering mechanisms that support them to do that. And I think representation is hard because of WA's diversity. Like, you can't just assume a small group of young people can represent a whole system. But I think what we can do is facilitate meaningful ways to empower young people to support other young people to be heard. And I think the most valuable thing that I've seen through the last 2 years is watching a cohort of young people who are part of the Homestretch trial, help design it, and those who are in the youth advisory function then become employed as consultants to learn and be supported to develop skills to then reach out to other young people. And much like you've been doing that with research, I think there's a whole different mechanism and a whole workforce that we haven't tapped into around this peer kind of lived experience workforce that can really ground us in truth and provide us the ways of understanding things that make sense for everyone. I've never seen people argue with actually I have seen once someone argue that a young person was wrong about their lived experience, but only once in 6 years. So.
That's reassuring. And I guess in designing the Homestretch, they were so integral in saying this is what we need. And even just hearing from their perspective, we don't want to just be put in a program. We want to have the flexibility to come in and out of that program as we need to. there were so many learnings I got from the young people that were involved in that as well. And as a researcher, to be asked, well, have you looked at this? We need, we want you to show evidence of this. And that really challenged me as a researcher.
I remember Darcy was quite angry when he heard there was such a low proportion of care leavers getting a degree.
Yeah.
And I think that fuels that kind of, I see lived experience as a real catalyst for us.
Yeah.
All of us want to achieve better things. We're in helping professions for reasons that drive us to do things. And young people really are a powerful catalyst for action. And I don't think Homestretch would have happened without young people's presence.
I agree.
And certainly the most impactful work we did as we tried to support. I mean, Homestretch WA for me was always about the rights of young people, a policy framework, not necessarily explicit program. But when we went across the state and tried to support others to understand how to imply those principles and that framework to their community, they only believed us when we brought young people with us.
Okay.
And I think it's the epistemic trust in what we're saying is true only comes when you've got those different lenses of seeing the world.
And what did you really learn about, I guess, the leaving care services as a continuum in the work that you did involved in Homestretch?
Look, I think for me, there needs to be a real focus on rights. I think we make a lot of assumptions that people and programs are going to meet what young people need. And it's very easy for us to commission and develop resources and expect young people to know how to access them or expect young people to be able to use them meaningfully. But if they don't work for those young people or if they can't access them, then there's no way for young people to challenge that. And so certainly when we talk about a system response, we need to understand what are the rights of young people and give them a clear understanding of their rights. And that sort of development of agency and trust in themselves to advocate for themselves, for me, is really part of that transition we're trying to create in a system. We're trying to take young people who perhaps have been taught that they can't do things for themselves, that they need others to support and guide them. And that's not every young person, but that kind of learned helplessness and that disempowerment that comes from a system that is designed to protect children needs to be intentionally restored and driven by a focus on empowering young people. And there was a question before around like how do we respond to young people who want to return to an agency? For me, I mean, young people didn't want a policy. They didn't want like a plan, a living care plan. Living care plans weren't important to them. It was a person. It was a relationship with someone they could trust and talk to that was important. And so I think there is not ever going to be a single service or magic wand for young people. So the other thing that I've learned is systems are built from relationships between people in a system. And so finding ways that we can flexibly apply the practice and knowledge that we know works without owning it or assuming that any program or government or district has the right solution. That idea of learning together and sharing information and not necessarily hiding anything or not necessarily creating like intellectual property rights. I know that agencies obviously need to be sustainable, but for me, Homestretch was built from the collective wisdom of everyone who shared quite generously. And I think that's where we start to build a system for young people where it is seen as a collective responsibility.
And you talk about the tools and resources. I guess Homestretch WA is making available a lot of the tools and resources like leaving care planning and the staying on agreements with foster carers and kinship carers. Do you think they're useful for the rest of the states who may not have those current resources?
Oh, look, I was very privileged to go out to Queensland and listen, hear what's going on and share some of our learnings around financial resources, how we support people to access them. I think absolutely. I think the states, as much as they are diverse in their child protection systems and legislation, are still trying to meet young people's needs that are fairly consistent. I think I look at the northwest of Western Australia and look at Northern Territory and the north and parts of Queensland, and we have very similar and quite complex challenges. And I think they working together and sharing that knowledge is really about developing the capacity of people. I think the other thing is I look at the US and how they rolled out a rights-based framework for their care leavers. And, you know, after 18, typically federal government is financially responsible for the community and paying for supports. And Homestretch kind of has shifted a bit of that responsibility back to states to finish the job of being a state parent. But I'm really interested to see how at a national level, like things like housing is such a fundamentally critical challenge that may not ever be resolved at a state level. But countries like Canada have committed to ending homelessness as a nation. So I think for me, those bigger issues really require us to share practice knowledge and respect the difference, but also challenge each other.
Yeah, in terms of like, I guess at the national level, do you think, there's talk about having some national minimum levels of standards or even a national charter of rights for care leavers? What do you think?
I absolutely think that needs to be built. I had the privilege of actually spending some time with other states and learning how they were trying to implement. And Victoria and WA have quite similar ways of seeing what we're here to try and achieve in terms of empowering young people. But some of the other states perhaps have gone down other routes. And I'm really challenged to see any state that sees its responsibilities for care leavers only being met through financial assistance. I think young people generally have identified that to connect and become part of their community and to meaningfully be valued, it's about building interdependence. And so building social capital and relationships from an early age. So I think we should be looking at a continuum from 12 to 25. We should be looking at standards and what is the developmentally right response? What are the tools and resources young people need in a system that supports them to grow their interdependence? And I think there are some real obvious things that come from extending a care system, the responsibilities around housing, around individual one-to-one support, around access to financial brokerage that builds capacity, the idea that there's a lot of flexibility in how those things can be applied. Those sorts of standards to me are really critical. And I think the other kind of key part of this is, as I said before, we don't change systems just because someone has an idea. We change it because we find ways to connect and understand each other. And so youth representation and participation in governance, in decision-making and in practice and policy is probably the other standard I'd be thinking would universally need to be applied, because we're never going to create solutions without involving the people who are affected by them. So, yeah.
And I guess as a researcher, I've got a question myself about, do you think it's necessary for us to continue the research and looking at the outcomes? But I guess the challenge for us is it's actually quite difficult to determine who is in home stretch programs and what they're getting, what service they're actually getting. Yeah. How come, do you have advice for the research community out there on how they can do that?
One of the things that I think is fundamental is that shared understanding. And that comes from having consistent, reliable data. Like, I think we don't want to follow and track young people. We don't want to be a compliance system. What we want to do is empower their voice and them to actually have their information meaningfully shared to allow them to access their rights and empower and equip us with the knowledge of whether or not the system's working. And I think at the moment, certainly when I left at the end of last year, there was an attempt to try and build a common database and we had through the community practice developed a common data set for people. And I think through that sharing of data, we had started to really understand the differences in different places and what worked well and what didn't and how that could be applied to strengthen and grow other places. So for me, there is a minimum data set that should be shared and of course, protecting Aboriginal data sovereignty, and we don't want to be looking at deficits, but certainly we should be looking, the research that was presented today, there are indicators early on that tell us what trajectory people are on. And so we should be able to follow up some of those things and empowering people's voice in being able to see what works and then build a system around that evidence.
And do you think, as we were talking about, even just during the presentations, there's some groups where we need definitely, I guess, more targeted support for specific subgroups of young care leavers. Is that your experience from being on the ground in practice about the young parent care leavers or young people with disability?
I think we certainly, the young parents in both the trial and the rollout, it was clear that there was a real specialised need for supporting young parents, and not only young mums but also young dads. That there weren't many, but those that were there were very few supports in place and resources to support them. And so I think the complexity of supporting a young person who's growing their own interdependence, but also now becoming a parent, learning how to be a parent, and that child's own developmental needs requires more than just one worker. And I think that's that collaborative integrated systems, but it's also, we've seen in youth homelessness, we've seen in the youth homelessness system, the development of specialist young parents programs. And I think they provide an equivalent solution and often end up holding on responsibility for young parents who are leaving care. I think the disability space is really complex and unique, and I know child protection was working on its own internal connection to that system earlier on. I don't think we can necessarily solve the transition to NDIS by waiting until someone's 18. I think early intervention and connection is really the solution there. But it was always my understanding from young people that they didn't want to end up in the child protection system. And independence and transitioning means that we don't maintain reliance and dependence to 25 and then have another cliff edge.
Yeah.
What we're doing is intentionally scaffolding all along the way, ways in which we empower and equip young people with connections and their confidence and trust in being able to access systems. And for those who have quite significant developmental challenges or, the complex co-occurring, challenges in their lives, I think, the YPECN program, it speaks to what needs to happen, that coordinated support, bringing together organisations and supporting them to work together is really, it's that kind of care coordination is critical. But until we've got a common data set, until we're going to start to be able to understand and position ourselves to respond to young people's trajectories rather than waiting for them to reach a level of acuity where we have to respond, I don't think we're going to be able to ever meet that need. And that's probably the real tension here is that as much as leaving care and investing in this other end of the system is critical, if we don't find a way to make a continuum that supports and identifies young people as early as possible around what they might need later on and meets that need, we're not going to ever reach a point where we can meet young people's needs. I think it's a challenging tension, but
yeah, and I think there's a lot of complexities to the current leaving care transition process that with the leaving care plans. And I remember when some of the young people were telling us in the co-design about how they were asked to put down everything that they think they might need in the future. And as a young person, that was an impossible task. And, they didn't put in, oh, well, I'm going to have a car accident and need physio and my teeth replaced. And then you go back and ask, I need some funds for that. It was really difficult and a challenge to do that. Or as a young parent, when you unexpectedly fall pregnant, to say, well, actually, I've got parenting needs now. I think that was something that really identified with me from young people's voice, that life is unexpected. Who would have thought we would have gone through a COVID pandemic and all the issues that created? Yeah. So I think the unexpectedness of life, and like you said, that interdependence, like sometimes you're traveling okay and then the challenges might, you might hit a challenge or roadblock. And that's when you might need that further support. Absolutely. I think that flexibility that you talked about is really needed, and that relational support is so key, which any young person, needs, whether they're with a family or within the transitioning from care groups. I think it's just how we make sure that the system responds to that need.
I think for me, the other group that is critical to this, I had the privilege of meeting, connecting with lots of Aboriginal organisations across the state. And for me, self-determination for Aboriginal families and young people, there's such intergenerational harm that has been caused. And this isn't about, blaming or holding anyone accountable who didn't enact that harm, but it's a recognition that, particularly in regions, the harm that has been caused is not going to be solved by commissioning an ACCO to do something. We need to look at a generational empowerment and agency of communities, and that's shifting away from seeing how a program or a Western way of thinking might be applied in a regional context. So we commission a program to do this, a program to do this, a program to do this, and actually going to a community and saying, well, what are the priorities for your community, and how can we use these clustered resources across departments to really energize and invest in the solutions that will work? So shifting, there are examples of that kind of model on collective impact, but really led by First Nations, emerging across the world, and particularly I think in Australia, there's already some exemplars of it So I think
Yeah.
that's the probably other cohort that I'd be saying we need to empower Aboriginal communities through more than just programs. you know.
Okay, so more than just a home stretch program, but looking at a collective.
Right.
And I think that's what you said before about sometimes the coordination of those services, that often they'll need more than just one service to meet those needs, and having an Aboriginal community-led place-based approach to supporting young
Families, and communities. I think
Yeah.
that's probably the complexity ahead. I think my other kind of thought is that very much how we see success and measure it. I think, I talked to what are the data sets. I think we can look to other systems, youth mental health and homelessness systems. This idea of intersectionality, and there is a cohort of young people who end up in Banksia Hill who have developmental challenges that impact their learning. They have drug and alcohol issues, offending behaviour. There is a complex cohort of young people who need more than just what we're currently providing. And I think there's a lot of those young people come from regions, and that solution is not even emerging from my perspective. I think there's a lot of work done on kind of justice reinvestment, but that intersection between the care system and justice is really one that needs some work as well.
Yeah, no, that's a really important point, Andy. Well, thank you so much for your time and expertise in this area. And we will make available the links to some of the information that Andy's talked about today as well. And we'll also make available the young person's voice who wanted to speak to some of the issues from her perspective. And I really do appreciate her for doing that. Yeah. And I'll pass over to Leah for some final remarks. Thank you.
Thanks so much, Mel and Andy. What an incredibly rich conversation that was. The intersection of data and rights, the centrality of young people's voice, localised responses that are more than just programs, and the importance of transitioning being an active process and not the creation of another cliff. Thank you again to each of our presenters today, Professor Melissa O'Donnell, Dr. Miriam Maclean, Dr. Fadzai Chikwava, Renée, Usher, and Andy Kazim. Thank you to all of you for making the time to join today's webinar and being such an engaged audience. And thank you for the many ways each of you are contributing to children's lives. A reminder, you will receive an email with a link to the recording for today's webinar and a feedback form, or there is a QR code on screen. People are still online. We had a glitch there where everything shut down, but we sincerely hope we'll see you again at a future ACCP webinar. Thank you.